So let's talk about this link between trauma and psychiatric and developmental disorders. We've certainly seen how in a child's body, the stress inflammatory response gets set on high, leading to inflammatory disease developing years later in the body. And when in the brain, the inflammatory stress response gets set on high, it can lead, we know statistically from epidemiological research, that can lead to mental health issues, anxiety, depression, mood disorders years later. And that is because synapses are lost, connectivity between important areas of the brain are compromised, and there's a loss of what we call gray matter volume. We also know that children with adverse childhood experiences have higher levels of inflammatory chemicals in the brain and body because we can measure their levels of inflammatory biochemicals now in blood tests, and we can compare those levels of inflammatory biomarkers to their symptoms of mood disorders, anxiety, and depression. It's fascinating research. We can see that children who at the age of 10 have higher levels of inflammatory blood biomarkers. For the nerds in the room, those include IL-6, C-reactive protein, and tumor necrosis factor, or have a significantly increased chance of developing a mood disorder by the age of 18.